Good morning, ma'am.
Good morning to you.
I'm back with lots of questions, ma'am.
Rasha, tell me.
Yeah, today we are going to discuss about IVF and its advancements, ma'am. Shall we start?
Yes, please.
Okay, ma'am. What is actually IVF, ma'am?
IVF, in vitro fertilization, we are not doing any more IVF, we are doing ICSI, intracytoplasmic sperm injection. 2 decades ago, where we didn't have ICSI in India, we were doing IVF, but now way back from 97, 98 onwards in India, we are doing only ICSI. And the whole story is because ICSI was pioneered by Palermo, where he was doing basically dealing with the male infertility, and he was trying to do the procedure of SUSI, subzonal insemination of the sperm for a male infertile. And those days there was no other treatment for these men with the infertility, with the low count, low motility, with the azoospermia. They had no other choice but to go for a donor, or they have to go for adoption. But what happened, because it was destined to happen, accidentally he pierced the ooplasm, and he went inside ooplasm, and he pierced the zona, and he went inside the ooplasm with the injection needle. And next day when he came, he saw the fertilization, he saw the chrononuclear.
Okay.
And that was the beginning of the ICSI. So before ICSI was SUSI, and after SUSI, then this happened by the miracle of God, and that's how ICSI started, which is a very important treatment for all the men with all kinds of semen problem, oligospermia, acinospermia, and azoospermia, obstructive azoospermia with the T-cell, and also the necrosospermia. These are the things that we do it. But now, even for normally indication, other indication like tubal block or endometriosis or the polycystic ovarian disease, for whatever tubal block, if patient needs IVF, we are not doing any more IVF. This is an old name and old terminology where we do ICSI, because ICSI it is giving the best fertilization. It's 95% is a fertilization. IVF, it was giving 45-50% fertilization.
It's a major.
It's a major breakthrough
Okay.
in the science in reproductive medicine and ART.
Okay.
Yes.
What is the success rate, ma'am, in this?
Fertilization rate 95%.
Okay.
And it depends how many oocytes we get. The more we get oocytes, the more we get blastocysts. So taking home baby rate is 50, 60, 70%. The patient has no
Oh, that's great.
So we do segmented IVF nowadays, where we are aspirating the egg, and then we do the ovum pickup, and we do the ICSI, and then we do the 5 days culture in the lab. Once the blastocysts are developed, then we do the vitrification, and vitrification onwards we do the maybe 2 months, 3 months gap, and then we do the FAT after 2 months or 3 months, depends on the patient preparation.